Treatment with neurotoxins for gum smile is off-label, but it changes lives, trust me. I have no conflict of interest, and this lecture was not supported by any industry. And this is my QR code. If you want to keep in touch with me, please. Don't hesitate to send me any message if you have any question. Well, smiling and aesthetics. The aesthetic of smiling basically depends on the relation between three anatomic components: lips, gum, and teeth. The gum is an important element in the aesthetic of smiling. Harmony is bound up with several criteria, including gingival health, the alignment and shape of the tooth necks, an aesthetically pleasing gingival line, and a harmonious smile line. The teeth also make an important contribution to the sense of the harmony of the face and smile. Depends on their size, shape, and color, but also on arcade symmetry. And third, lips are very important, having a major impact on the beauty of the smile, as they delimit the aesthetic area. Their interrelation and length greatly determine the amount of teeth and gum exposure during smiling. And when is a smile gummy? What is the definition? It's so difficult here. Thank you.
Can I just suggest, if the AV could help us with the clicking your end, and if you could just mention next slide.
Okay,
Yeah,
okay, I
let's
will
do that,
try
and then
first.
it'll give you, yeah, give it a go, and if not, then AV can help
Look
us out.
at me, please, okay? So, excessive gingival exposure, gum smile, is a non-aesthetic condition characterized by excessive exposure of the gingiva during smiling. It is said to be gummy if more than 2 or 3 millimeters of gum visible during sustained smile. This is confirmed on forcing smile. A gummy smile can vary in severity, falling into categories of mild, 2 to 4 millimeters of excessive gum display, moderate, 4 to 8, or severe, more than 8 millimeter. In 88% of cases, it manifests as a continuous band of gingival display in the anterior-posterior direction. However, it can be localized to the anterior or posterior regions in specific cases. The regions of gum smile are typically multifactorial, complex, and usually result for a combination of factors. And this is multifactor etiology of gum smile. Today, of course, we'll talk about hypermobile upper lip. These muscles are involved in gum smile. All of these muscles: orbicularis oris, zygomaticus major minor, levator labii superioris, rizoris, buccinator, and LLSAM. But the more important is zygomaticus major minor, LLSAM, but I do treat orbicularis oris. Well, does anyone inject differently from here? Oh. Does anyone do another points from here? Right. Because we need to understand that we have a classification of gum smile. We don't have just one type of gum smile. We have anterior gum smile, mainly involving the action of LLSAM, posterior gum smile, mainly involving the action of the zygomaticus, mixed gum smile involving all of this muscle, and of course we have asymmetry caused by asymmetric contraction of the muscles. And the treatment is a botulinum toxin that induces muscle paralysis by inhibiting the presynaptic release of acetylcholine at the neuromuscular junction. It is a good alternative to address a gum smile caused by the hyperactive lip. So the first type of gum smile that I want to talk with you is anterior gum smile. I use it to do these 2 points, not just 1 point. And the amount of the units of the toxin is 4 to 6 for each side when it's symmetry, but when it's asymmetry sides, I make this balance. And then the other point, a little bit down, 2 units. For posterior gum smile, we don't need to block the LLSAM, so we go down and inject 2 points with 2 units per side. And mixed gum smile. We do everything, okay? And what I like to do is to add these 2 points on the auricularis oris when the person smile turns her lip, and I like to do that as I will show you. I'm trying. Right. As you can see here, she has a mixed gum smile, and when she smiles, she turns her lip. So I will do 3 points for each side, even this point on orbicularis oris. And now I'm injecting 4 units, 2, 2. And the same the other side, 4 units, 2, 2. She's with topical anesthesia, okay? So it's very comfortable. Even in the lips, 1 unit, and now, I think she feels something. And this is the result. She works with me, so she's so happy. She didn't know about this kind of treatment for her gummy smile. And now for a man. He does the same. When he smiles, he turns his lip, and I will do all of the points. He's laughing and smile because I didn't make some anesthesia, topical anesthesia on this guy. You know why? He's my husband. And he's right here. If you want to see his smile, he's right here. Love you. But look, he's very handsome. Look. I didn't treat his teeth, okay? I'm not a odontologic professional with the light of the camera, but it's much better. And what about the stability? Well, in my practice, the result of the injection started to disappear after 12 weeks, and normal function returns at 24 to 30 weeks. So I usually do in 4 or 5 months. And some of my results. People live better with toxin. When she smiles a lot, she exposes a lot of her gingiva. This one I associate with lip filler. Lip filler too. Natural, beautiful. However, we must be very careful before starting to inject in all of patients. These patients, for instance, she mentioned that she ended up with mouse smiling, you know? She didn't like it. And why she didn't like it? Because her teeth are so small, you know? So one tip is to hold your finger in the muscle and ask for the person to smile. Okay, and then look at the neuron. Do you like it? Yes, I do. So let's go and do it. Otherwise, we can inject less. Okay. Thank you for your attention, but I have another lecture.